Minors or adults who are brought into sex trafficking are a significant cost to society from the perspective of medical care costs. The most common medical care problems that they will have will include victimization through intimate partner violence. Violence is perpetrated either by the offenders or pimps or by the consumers or johns. We know that intimate partner violence can include sexual assault, psychological damage, physical battering, isolation, degradation for victims, and we know that those become the quintessential example of an adverse childhood experience. And the research on adverse childhood experiences reflects the fact that the original traumas that these victims experience then go on to cause lifelong chronic disorders, to include heart disease, cancer, diabetes, autoimmune disorders. And so if we can keep children from experiencing probably the most underreported form of child abuse and one of the most severe forms of child abuse, in fact in many arenas would be referred to as child torture, if we can help children not experience that, we will diminish the cost to them, to our society, for medical care. In addition to the problems of physical battering that we see in intimate partner violence, we also see the problem of substance abuse, which is very often introduced to underage minors by these very same traffickers in an effort to keep them dependent upon that offender. Or minors will resort to the use of illicit drugs in order to cope with the extreme trauma that they're experiencing when they're being trafficked. The genitourinary tract and reproductive system problems that occur include infertility, they include chronic pelvic disease, sexually transmitted diseases, and of course HIV/AIDS. The cost of caring for patients who have sustained those kinds of problems are very significant, as we know, and really will require a lifetime of medication management in the case of HIV/AIDS in order to prolong a person's life. And then the final area of cost for children who are being exploited through commercial sexual exploitation is the area of mental health impact. The research has shown that clearly more than 67% of victims will have problems with post-traumatic stress disorder, depression, and anxiety. And just the cost alone of medication management for those diagnoses is a very significant amount of money. If we can avoid any or all of these four major areas, intimate partner violence consequences, substance abuse consequences, genitourinary tract problems, as well as mental health problems, and all the associated medical care costs, we will tremendously diminish the financial burden to a community. Recognizing that children should not be sources of sexual gratification for adults, we understand already within the concept of child sexual abuse. Sex trafficking is just the worst case scenario of child sexual abuse. Just as we would see this kind of treatment of soldiers as torture, we should not fail to recognize that it constitutes in many ways a form of torture against our own children. And the fact that we as a country have provided more services to international victims as compared to children born right here in the United States is probably one of the greatest disconnects that exist from this phenomenon. We need to recognize that just as children can be trafficked from East India or from Thailand to the United States for sexual exploitation, children from New York can be trafficked to California for the very same reason. And we should have a uniform means of providing not only help and rescue, but we should also have a uniform means of providing consequences to offenders who provide these kinds of crimes against children.